it depends on the availability, on the lab that is attached to the particular service, either academic service or hospital service or a private clinic, and the methods being used. In my institution, we are using still single gene testing as a first line, although the recommendation is to use what's called an NGS or next generation sequencing platform, which has more genes on the platform or the panel itself. So the EGFR is the most important mutation that should be tested, and this is should be or most commonly available in most places. The limitations is the accessibility to these tests and the costs that these platforms or tests bring with it. The ideal platform would be an NGS testing, where at least 9 genes are being used that are recommended by the NCCN guidelines and ESMA guidelines to test for upfront in patients with incurable lung cancer disease or metastatic disease. The turnaround time is important, and that varies depending on a country. If it has to be sent away to a different country, then there will be, of course, time needed to send the sample away. Ideally, it should be within sort of 10 working days. Also, it depends on what the setup is. If the diagnosis is made by a respiratory physician and the test is being done as a sort of reflex testing, then the results will be available in the tumor boards or MDTs and should be available when the patient sees the oncologist. The testing is most commonly routinely done in the advanced stage, and if done so in the earlier stages, the time frame or the time for the results to be available is not so critical. In terms of moving on from EGFR to the other mutations like ALK or ROS1, and that has been expanded to RET-MET mutations, NTRK mutations, HER2 or EBR2 mutations, that again depends on availability and is usually done on an NGS platform. Ideally, this is what one would want to have open in each center. But again, it depends on the availabilities in terms of lab doing these tests either in-house or being sent off.